Last year, one of the stories Checkpoint covered at greatest length was the crisis in the urology department in the Southern DHB. Indeed, there were pressures in other areas of Dunedin Hospital, but those in the urology department culminated in an external review and revelations on Checkpoint that prostate cancer patients had suffered seriously problematic delays to their treatment. All of this happens, of course, as the ageing and overwhelmed Dunedin Hospital nears the end of its life. A replacement to come exactly where and when still to be exactly confirmed. Among those working on the planning, Pete Hodgson, a former Health Minister under Helen Clark, and Dunedin North MP. Both of those positions, incidentally, are now held by David Clark. Now, Pete Hodgson is chair of the Southern Partnership Group, and he's also put together a local advisory group that's meeting for the first time tomorrow.
Well, it's a group that's ancillary to the main consultative group, the so-called Southern Partnership Group, and it's designed to take a look at stuff that isn't health. So, for example, what's the impact of this very large new hospital going to be on transport or public transport or access to pedestrians? What do we do about, let's call it cityscape or land, the streetscape, or the things that are where the building is going to impact on the rest of the city. We need to make sure it doesn't cast too long a shadow. We need to make sure that if there's going to be a district heating scheme, that it's something that embraces the hospital and other businesses as well, and so on and so on. So a bunch of things that are to do with building the hospital, but not necessarily, in fact, not at all, to do with the health or health provision parts of building a hospital.
Right, much easier to have those conversations when you know where the hospital's going, right? Do you have a preferred site?
We don't yet, but we will rather shortly.
Do you have one? Do you personally have one? Gosh, you've been Health Minister, you were the Minister there for about 200 or 300 years, weren't you?
No,
sorry, the MP
there. I know roughly where it's going to be. I know roughly in which few blocks it's likely to end up, but there are quite a few permutations, and so
Which few blocks? Which few blocks?
Well, we haven't narrowed it down yet, John, so we're not about to tell you breathlessly on your mighty fine radio program, but I can tell you that it'll be north of the Octagon, south of the hospital, on flat land, and probably, as the current hospital is, alongside State Highway 1 on one side or even on both sides. So people who know Dunedin,
I know Dunedin, and that's not a big.
Dunedin.
I know, and that's not a big area you're talking about. So that's actually pretty specific.
So we are getting it narrowed down,
yeah.
but I'm asking people also to remember that it might be over 2 blocks. Not that we need all of 2 blocks, but parts of 2 blocks, or just think laterally that it doesn't have to be in this great big rectangle or that great big rectangle. It can be a mixture of those things. In fact, the current hospital is also across more than 1 block.
Yeah, it is. Can we talk about how much money you need? I think the ODT called it a $100 million sticking plaster, right? Until that hospital will be open in roughly 7 to 10 years' time. Is a huge funding injection required simply to keep Dunedin Hospital stumbling on?
Well, it's not clear to me that will be the amount of money required. I simply don't know. And it's not the project that I'm engaged with, though you do raise an important point, because the sooner we can get this new hospital up, the lesser time that we need to put, as you call it, sticking plasters on our existing hospital. And yet, even by the very best of intentions, there are certainly some things that will have to happen in the existing hospital. There are parts of that hospital that are really very crowded indeed.
Yeah, there are. If we look back to June 2015, I suspect you're not going to be remotely interested in commenting on this. This is when David Clark's predecessor as Health Minister, Jonathan Coleman, sacked the DHB and appointed a commissioner there. And he said, Health Minister Jonathan Coleman has today written to Southern DHB dismissing all members of the board and replacing it with a commissioner. Now, all the imperatives, all the justifications were around financial reasons. Since then, we've had the crisis in urology, we've had the really confusing waiting lists in cardiac surgery, we've had the shortages in ICU beds, we've had deficits, we now need a $100 million sticking plaster. Is it your sense that the commissioner should be staying on?
It isn't for me to comment. You're quite right, and I know the limitations, having been a minister in an earlier time, that it's not a very wise idea to pretend being minister now. So I'll gently sidestep your question. But with this remark, John, and that is that though there's plenty still to be done at the main Dunedin Public Hospital site, there is still some serious crowding. There's also coming up a brand new ICU facility, a brand new gastro facility, and so on. So there are some investments that have been made that will make things better. The point that you're making is that not all of those things have been done, and that's quite right. There's still there will be a shortage of beds in the ICU space this coming winter, I have no doubt.
One final question.
I'm sorry, in the ED.
Yeah, no, absolutely. Sorry, yeah. One final question in terms of local representation. Tim Cadogan and Gary Kircher, who are regional mayors, and you're not going to die wondering what either of them think, and they're frequent guests on Checkpoint, and they have the delightful quality of stabbing you in the front. They are saying, hey, this isn't really local representation, because don't forget, this isn't just a Dunedin hospital, it's a regional hospital. Should you have one of those mayors on your advisory group?
So I've spoken to those two guys, and in fact the other regional mayors in Otago, though not yet the regional mayors in Southland, who will no doubt ring me when they hear me talking, to say, give over, guys. This is substantially a Dunedin business. It's the issue about Dunedin's cityscape and streetscape is not an issue, or transport problems or whatever, is not an issue for the mighty fine mayors of Oamaru or Alex. And indeed, I've spoken to all of them, to the mayors of Queenstown, Lakes and Clutha District as well. And you can ring them and get your own view, but because we're in dialogue, I think there is a level of trust. There is a sense that they have that they can ring me. They've all got my number. They all know what the local advisory group's about and what it isn't about. They've all said we need to make sure that there's good parking facilities for out-of-town travellers. You better not forget that, Pete, etc. No, I don't need all four of them or any one of them on this local advisory group. It's not a representational body. It's a group designed to get things done and get decisions taken as quickly as we can. And yet, if we think there's anything that's of regional consequence, I'll be the first to be back in touch with them.
Pete Hodgson, who is the chair of that advisory group and the Southern Partnership Group, of course. We will keep an eye on where Dunedin Hospital is going, although fairly precisely mapped out, I thought, by Pete Hodgson there, particularly if you know that part of Dunedin, that isn't much room he is talking about.